Welcome back to the program. Thank you for staying with us this far. But in case you are just joining us, karibu tena sana. This is Good Morning Kenya, and I am Jain Wambui. Remember, we'd love to know where you're watching us from today, so feel free to interact with us. Check in on our various social media platforms. The official hashtag we are using on Twitter is Good Morning Kenya. Our official station handle ever remains to be at KBC Channel 1 across all the social media platforms. My handle is at Jain Wambui. We welcome you to share with us your thoughts in regards to this discussion that we are about to embark on our Family Check segment today. It is all about retirement. Do you have a plan for the retirement years? What next after you retire? Given the official retirement age in Kenya is 60 years, but from the age of 50, you can opt for early retirement. What plans do you have for that? Because looking at the Kenyan space, it has been noted that more and more Kenyans are becoming poorer after they retire. But why is this the situation? Today, we look to question this and understand where we are as a country and what you and I can both do to help prepare for our life after retirement. With us in studio to help with this conversation, we have three gentlemen who are going to be key in sharing more information about this particular discussion. To my immediate right, we have Elly Ndwiga, who is the chairman of Sauti Sacco and also a beneficiary at KERO. Good morning and welcome.
Thank you very much.
And next to him at the center, we have Ahmed Hussein, who is the chairman of the Kenya Association of Retired Officers. Good morning and welcome.
Morning to you. Thank you.
Karibu sana. All right. And right next to Ahmed Hussein, we have Wachira, who is the Secretary General at KERO. Good morning and welcome.
Good morning. Thank you.
Thank you so much, gentlemen, for being with us today. Now, again, if you have any questions or comments, or if you're just seeking clarification, we welcome you to share them with us. We'll be getting to them as and when that will be possible. So let me start with you, Ahmed Hussein. You are the chair of the Kenya Association of Retired Officers. For the benefit of our viewers, just tell us a bit about the association.
Kenya Association of Retired Officers was started in 1998 by retired public service officers to bring together the officers so that they could discuss their welfare and also come together and look at what is best for them in retirement. This was occasioned by the fact that retirees face a lot of problems upon retirement, and therefore this was meant to improve their welfare.
Yes.
And we have had a lot of things that have happened since then, and I must admit that KERO has had a lot of impact on retirees since that time.
All right. Now, let me come to you, Elly Ndwiga. You are the chairman of Sauti Sacco and also a beneficiary of KERO. Yes. But before you tell us a bit about your involvement in KERO, tell us a bit about Sauti Sacco.
Thank you very much, Jain. As the chairman of Sauti Sacco, I want to say I'm chairman of Sauti Sacco by virtue of having worked with the Ministry of Information and Broadcasting those days. Sauti Sacco is a cooperative society for employees of the ministry, which was started for the Ministry of Information and Broadcasting then in 1972, so it means we are marking 50 years now. It has transitioned and people have moved to various ministries.
Yes.
So right now, I am the chairman, and mainly we draw our membership from Ministry of ICT and also Kenya Broadcasting Corporation. But we have members drawn from all over. We opened also our common bond, so we have members who are outside the common bond. So basically, it's to take care of those members under those organizations that were within the Ministry of ICT to help them to save.
Yes.
It was mobilizing money so that then you can be able to do great things in numbers. Collect money, and then you are able to help one another in terms of all that. Yes.
Fantastic. Yes. Now, let me come to you, Wachira. You know, as the Secretary General at KERO, the Kenya Association of Retired Officers, tell us a bit about your role in the organization.
Well, yes. As the chairman has mentioned, Kenya Association of Retired Officers was formed in 1997. At that time, when it was formed, I was still in the civil service, and I did not retire until 1999. So when I came out, I became a retiree. When I retired in 1999, I saw a lot of problems that the retirees were undergoing, particularly to do with the low pension levels. Their social standing was being eroded. And so I joined them to be able to work with them so that we can address the issues that the retirees were facing. At that time, you find that salary structures were very low. You know, the economy was not doing very well.
Yes.
And it was not until 2005, after the NAC government came in, that there was a revival of the economy. Before then, the economy was almost stagnant. And therefore, the pension levels were very low, salaries were very low. And you know, pension is based on the salary one has, the last salary one draws, and of course the length of service.
Yes.
So the main problem that the retirees were encountering was to do with the low pension levels, stagnation of the pension, by the fact that there was no review at all. And so we kind of decided to address the issues with the then formed Salaries and the Remuneration Commission. So we prepared a memorandum to get them to see that the purpose of paying some of their pension is to enable that officer to sustain a standard of living, a reasonable standard of living.
Yes.
And so that once you retire, you don't become a disgrace in society by the kind of poverty into which you had kind of pushed into.
Yeah.
So the SRC listened to our complaint, they addressed the issues, and they saw the need to ensure that there will be no disparities as between the pension levels which were pertaining to the old generation of retirees and the ones who are retiring currently with very high salaries. Because after the NAC government came in, the challenge of revival of the economy necessitated the hiring of high caliber manpower. And the only way the government could then attract those high caliber manpower was to improve the terms and conditions of service and hike the salaries to be able to attract those people from wherever they were.
Okay.
Therefore, since then, salaries have escalated, they have gone up, and therefore, pension that is done by those who retire now is very high compared to those who were there before. So that kind of disparity is very ugly and demoralizing to the old generation retirees.
Okay.
So we as KERO and we as Secretary General, we address the issues squarely with the agencies concerned. The Salaries Commission, they kind of came up with definite recommendations. The Treasury were given the recommendations. His Excellency the President launched the recommendations. So that we have a situation, we should have a situation where once you retire, the pension level or your pension should not depend on when you retired. It should rather depend squarely on the status you held at the time of retirement and the length of your service.
All right. Now, that brings me to the next aspect, and this is in line with the challenges that we are experiencing as a country when it comes to retirement. And I like the fact that you've brought in the whole aspect of, you know, the salaries and the structures that were there prior to the changes that came in 2005, and particularly facing public employees. I'd like to hear from you, Ahmed. You know, the situation then and after the changes that came in, and have they been effective in this day and time?
As Mr. Wachira has said, the low pensions affected the pensioners who are public servants, and it affects their dignity, affects their standing in society. And when the changes came, the new retirees started getting very good pensions.
Yes. Which were based on their salaries.
Based on their salaries.
Yes.
But these old retirees were left to take what they were earning before, and you will find a PS who retired in 1998 earning about 20,000 now, whereas a PS who retires today is earning about 300,000 shillings. So that disparity really creates a big problem. Now, the other problem that comes around with retirees when they retire is that the older you get, the more medical attention you require. You require very good medical cover. And when you are in the public service, you are entitled to a very good medical cover through NHIF.
Yes.
Once you retire, that medical cover comes to an end. and therefore you are left on your own with very meager pension uptake every month. So because of that, we realized that we needed to form the Kenya Association of Retired Officers and started a medical scheme, a medical cover in 2018, where KERO members join, pay for a medical cover negotiated with NHIF, enhanced, and that way then these people can be able to attend good hospitals, attend good treatment, and not depend on the UHC alone. Now this has its own issue because the pensions these people are earning is very low, and therefore the issue of family and friends come in. You'll find most of the pensioners who are on the scheme, their medical cover is paid for by their children and their family members.
Out of pocket.
And that has effect on the family members also. Whereas these people have worked for the government 30 years, 35 years, and they were just left on their own to survive in the what do you call in the country, in the wilderness, I would say. So the cover assists those who can get support, but that does not mean that it covers all the retirees. The other retirees are suffering. We're under the UHC, and you know, the older you get, the more medical attention you require.
Yes.
You become like an old car. You need a lot of repair, a lot of changes to your organs, to your system.
Yes.
And therefore, because of that, there was need for us to start. The most fundamental issue was the medical cover, because that is the biggest problem that faces retirees in this country.
All right. Now, before we get even further on that aspect of, medical expenses that do come after retirement, let me come to you, Elly Ndwiga. And, the other aspect or other challenge that we see in the country, we have many different entities that offer pension plans, but for some, they're very poor performing. And we've heard, from Ahmed, there are people who are earning as little as 20,000 post-retirement. How is this a problem, and how can it be sorted out in one way or the other, looking at poor performing plans?
I think it is a serious challenge, and from where I sit, and being a Sacco chairman, I am dealing with the members who are suffering, and my heart pains when I see the kind of suffering they are going through. They want to come to the Sacco to be assisted, and because of a medical issue, there is their pension that has not been paid and all those kind of things, and I feel for them. I will want to look at it. There was a time I had an issue myself personally, because I'm a beneficiary here. When I retired, and I realized I was in the wilderness, and we were trying to look for money to send my wife to hospital, to India, for treatment. I don't have a cover that can take care of me. And then in the process, and because now it becomes a community issue, somebody in the Middle East asked, have you heard of Kenya Association of Retired Officers? Maybe they can help you. And I decided, let me go and find out. I went to KERO, and when I heard the story, I decided, let me pay the premium. And the premium was 100,000 per year, plus all that, and I had a cover of 2.5 million. A cover of 2.5 million, which of course I can't get from my other insurance companies. This is an NHIF cover negotiated, and for that I was able to take care of this need to go to India for treatment. And in fact, in addition, even the NHIF also, that cover even paid for the air ticket for her and the caretaker. And I come back and look at it and see. And this is what I've been asking. Do we have schemes that can take care of members? And can KERO assist members who are suffering? Because you get out of employment and you are alone.
Yes.
And then you are in the wilderness. I know there is something I've been trying to also talk to my members, because as a chairman of a Sacco, I wanted to see how the Sacco can also help them in terms of taking care, mitigating that, because I'm meeting them daily. I have had experience with some people who have been saving for their retirement. Because initially, the issue was you could be in a Sacco, and when you leave employment, you just collect your money and go.
Yes.
But I know there are people who have decided they are going to save money in the Sacco, not for purposes of borrowing loan, but for purposes of their plan later.
Yeah.
Because you never know what will happen with your employer. You don't know what will happen with your pension. So you accumulate money, and I've seen people who have accumulated more money, and for example, somebody had accumulated 10 million shillings. He decided to take this 10 million and they decided to put it in a fund where they are giving 25%. With a 25% return dividends, it means you get about 2.5 million per year. Spread it is 200,000. That will be able to take care of your premium, to take care of your medical bills. Because as they are saying, medical is very key. I am out there. I have seen members in the cooperative. I am a Linda also in Nairobi with other cooperative Lindas, where we have a forum where we meet. And today we are saying there needs to be an issue, not only looking at these pension fund managers, yes, but even on a personal level. How can you invest so that you take care of your retirement life after that? Because
again, going to a proper performing plan.
A performing plan, yes, even at a personal level, yes, even without looking at the other guys. Sometimes the problem is we have very good salaries that we can be able to spare, yes, but then we don't think about tomorrow. We are thinking about today, but you can be advised and think about tomorrow and invest it. KERO, the problem we have is I leave employment, and my little pension, I cannot use it to do a medical cover. For example, you're talking about 20,000. This 20,000 which you are talking about, if I take a cover, how do I pay for that cover now?
It's not practical.
So that becomes an issue again.
Yes, Ahmed.
Yes, I think what Elly has said is very important, but the more important thing is there are many public servants who are retiring. Thousands every year, every month. And we have been encouraging them, or we want to encourage them to join KERO so that they have a continuity of their medical cover with NHIF. I tell you, outside, I will repeat again and again that the biggest issue that faces retirees is medical. And you will only know about medical when you get sick, and members of your family and your relatives and your friends have to come together to fundraise. But if you take a cover that takes care of your medical needs, you don't need to bother the entire community, the family. And two, sometimes it's an emergency.
Yes.
You can imagine somebody has just had an attack, and you take him to hospital and you are asked to put a deposit of 300,000. That moment, that now becomes an issue. The hospital will not admit this person, and you know how expensive our hospitals are. So the most important thing, two things here, that people who are retiring must plan for their retirement and prepare, invest in what they will do during retirement. Number two, worry about their medical cover.
Yes.
That those two issues must be done. And when you're in the public service, sometimes you don't realize that you're retiring.
Until you retire.
Until you retire. And when you retire,
yes,
then the government that has been with you, that you have been working for the last 30 years, just disconnects. You know, it disconnects. And you are left on your own.
Yeah.
And therefore, the preparation for retirement is very, very critical. And I think government must invest in that. But anybody who is about to retire, medical. Think medical first. Think about your medical care, and third, think about your medical care.
All right. Medical care, medical care, medical care. Yeah. Now that brings me to the other challenge that we also see retirees facing. Number one, medical care coming at the top of the list, but we're also living in a time where there's some retirees who are outliving the plans that they maybe would have already had in play. How is this a problem, and how can it be addressed, and especially looking at what KERO is doing? Let me hear from you, John.
I think what you are saying as KERO is that an officer, when he's in the service, he draws a certain salary, and then the pension is calculated with a certain formula. What he is urging or sort of lobbying the government is that when somebody has been paid that pension, the purchasing power of that pension should be maintained so that as inflation bites into the purchasing power of that pension, there should be adjustment for the cost of living. So the beauty and the need for members to join KERO is that they have a forum, they have a body which is negotiating with the government to ensure that depending on the level of inflation, the pension is accordingly adjusted to ensure that the purchasing power is not eroded.
Yes.
But of course, the other aspect is that one must learn to live within his own means. That's very, very crucial. And I think the government has come up with or is coming up with a policy of preparing a post-retirement medical cover. I think they have negotiated, the Honorable Branch has negotiated with the government, and it's almost being rolled out.
Yeah.
That would be a very, very important area of assistance to the retirees, so that once they are serving or leaving the service, they don't feel like they are neglected.
Yes.
In other words, the need for health care is continuous. It does not cease on your retirement.
Okay.
That is the most important thing. So I think I would like to urge anybody who's in the service on retirement, join a group like KERO, there we are for them, so that together we can dialogue, discuss, share problems, and be able to, as a group, negotiate with the government, the employer, and the various other agencies, the public corporations, to improve the quality and the standard of living for the retirees, so that their dignity is maintained. It should not be a situation where, when you are told you are to retire, when you get that notice that you are due your retirement age in 6 months' time, you start panicking because you view pension as kind of a lost due. You should retire with the dignity, embrace it. After you have served your country for so many years, the system should be able to put in place mechanism where that dignity of the person is maintained.
Okay. Now, let me come to you, Elly. Looking at the whole question of, again, maintaining a life with dignity post-retirement, there comes in the question of debt. And we know debt becomes a big problem for people if you don't manage it properly over the course of the time that you are working. How does debt affect one's life after retirement?
Debt, many times we advise that when you retire, make sure you don't have debt. But sometimes debt is something that you have to live with, but then know how to manage it. Because sometimes I will want to talk of a practical case here where you have taken debt and you think you will be paying it through your pension after retirement. Somewhere along the line, the retirement does not come. And so, how do you pay? It starts now getting back to you. That health we are talking about becomes an issue. If it were possible for people to live without debt, it would be good. But then it is not possible to live without debt.
It's a beautiful reality to wish for.
Yeah, wishful thinking, because we need to, we have to. But how we manage the debt, and that's why I was bringing the issue of mitigating the areas where you think it's risky. For us in the movement, we are trying to see how to help these people as they get out. So our retirees as they get out, so that when they come out here, the Sacco movement helps them to live a decent life. And that is why we are telling them, even when you retire, don't withdraw from the Sacco. Yeah? Let's look for a way where you retain your membership in the Sacco, because this one will help you. And even before you retire, can we walk this journey with you to tell you that you can be able to start saving? Save for 5 years in a plan that you are going now to take care of. Because for those who are out, there is that which we have seen. So when you are out there, these are the challenges that you are going to face. And when you start doing this, putting this money here, then it will take care of your small issues, and then you'll be able to handle. So you are able to mitigate on the debts now.
Yes, you live a decent life.
I think
now, before you get to add on to that, we have to take a very quick station break, but we welcome you to keep sharing with us your thoughts. We will be addressing them as we come back from this commercial break. Do stay with us.
Thank you.
Welcome back. Thank you for staying with us. This is all about retirement and planning for retirement. Why is it that we're seeing so many people still languish in poverty post-retirement, and yet they had a very fruitful, at least 40 to 30 years of working. But post-retirement, life takes a complete 180-degree change. With us in studio, we have Ahmed Hussein, who is the chair of the Kenya Association of Retired Officers. We also have Elly Ndwiga, who is the chairman of Sauti Sacco and a beneficiary at KERO, as well as John Wachira, who is the Secretary General at KERO. Now, before the break, we were looking at the aspect of debt, and I'd like to come to you, Ahmed, looking at the impact of debt on pension post-retirement, and those who actually, count on pension to pay off some of the debts that they had accumulated.
First, upon retirement, the pension you earn is reduced salary, about 50–60% of your salary, with all the allowances gone. And therefore, the more you live on that pension and the cost of living goes up, your pension remains stagnant, static. The figure doesn't change so much. Every 2 years, you get about 3%, which started recently. Now, investing and getting into debt when you are on retirement and when you need to maintain your standard of living is an issue I would encourage members who are retiring not to get into. Because your income is not expanding, your income is not increasing.
Yes.
Your need for support services, social, medical,
increase
is getting higher every day. So that I would encourage, and I would ask any member who is retiring to avoid issues of debt as much as possible. However, if that upon retirement, the first few years maybe, but if we have people who have retired as members of KERO about 35 years ago. Good thing is the retirees are not dying so soon these days. Many of them are living to 80 to 90. And this is as a result of the increased standard of living, proper health care. And therefore, to maintain that, I think there is need to invest more, not only in health, but in also social welfare, to engage, to be relevant to society. Because the older you get, the more contact you have with people. And more importantly, again, upon retirement, it's like you stop a certain way of living, certain group of people you have been interacting with, all your telephone lines will change, and therefore this is the time when you need to live a new life, a life where you interact. And you can go back to your rural area if you come from Wachira or you come from Busia and you have been working in Nairobi or Mombasa for the last 30 years. When you go back home, you are a stranger. So you need an environment where you can live, an environment where you can interact with the people, and you need to live as close to the way you lived before. And this is why preparing and planning for retirement is very critical. And two, I think the government, which is the main employer of the people who are retiring, must think of retirement. The people who are in the government don't know what is waiting for them. They don't know, once they get out of that office, the tea on the table, the money for telephone, the allowances, all those things come to an end. And you will be left on your own. And your phone will stop ringing. Immediately you leave that office. And therefore, I would urge also those who are still in the public service to prepare themselves and work on how to improve the welfare and services for retirement. I wish to say, as part of what Mr. Wachira has said, we have been talking to the Minister of Public Service. We have been agitating for the medical cover. Although we have the private medical cover, most of the retirees cannot afford. And therefore, the government now has worked together with us on a post-retirement medical scheme. The policy is ready. The processes are ready. They are now working on the actuarial study, so that maybe by early next year, all retirees can transit into that. And that is now what will change the face and the welfare of people who are retiring from the public service. But as it is now, the situation is not good. And whether you are a PS or whether you are the lowest person in the cadre, once you get out, life is different. it's like moving out of enclosure to the open. I think it's just like recently I was seeing some wild animals, elephants were brought from the UK, and they were caged in a sanctuary, and now they are being released into the wild. And I want to tell public service and public servants, it's like you'll be released into the wild when you leave the public service.
You never know until
and they are already released, by the way. And in fact, I think the best, looking at what my chair is saying,
yes.
I think he is addressing more those who are currently in service.
Yes.
Now, what about the practical aspect? Those who have now exited and they are out there and they are suffering. I have them as members.
Yes.
Yeah, how do you deal with
I
this?
think we need to start processes of educating people.
Yeah.
Yes, creating more
People
awareness.
need a lot of advocacy, a lot of change.
Yes.
People need to hear and feel and see what is waiting for them.
Yeah.
And old age is not only affecting former public service, it also affects the rest of the Kenyan people.
Okay.
And in the global community, especially in the first world and Europe and America, Australia, when you get old, you have privileges.
Yes.
You have privileges. You have medical cover. You have reduced cost when you go to the supermarket. When you board the pass, you pay less. Why? Because you have made a contribution. But in Kenya, I say it again and I will say it, you are left on your own, and you pay like the 30-year-old engineer pays for his services.
We'll be coming to the policies that we have in our country around such matters. But let me hear from you, John, looking at that aspect of debt and also just our Kenyan space and preparing for retirement.
I think my own take on this matter is that, it's the whole process of life and the philosophy one has. You see, people must appreciate that really we come to this world to serve. God, our Creator, brings us into this world so that we can be of use and contribute to the welfare of other people. And in that process, we are also taken care of. So, particularly in the public service, it is the area where one can be able to give a lot to the community, not necessarily for personal gain, but basically for that sense of satisfaction that you are rendering useful service to your community.
Yes.
Personally, I feel that after I served the Kenya government, or my country for 36 years, I feel pride, and many people feel proud for what they contributed. So I think we must educate our people that life, when you begin it, is a process, and as you go along, as you age, you must change your thinking, so that after a certain age, maybe 45, you must now see the graph is not really shooting up. You're now either leveling or starting to go down, and moderate your thinking and your ambitions and your aspirations, so that by the time you retire, you should have matured enough to realize that life is not just a struggle. You must reach a point of arriving, taking stock of what you have done for your country, not so much for yourself, so that you can gain peace of mind, to feel that I've done my bit, and going into debt, which are far beyond or well outside your means, is not wise. Because you see, you will suffer it, or you make your families members, handicapped. So I think it's a question of retirees accepting that as they go along the graph of life, you must reach a point where striving must stop, and you feel that you are arriving. You must develop means of achieving peace of mind, not necessarily by living a life that is well beyond your means, because of a disturbed ego. Accept yourself the way you are, trying to better yourself, and the sense of having served your people is fulfilling enough, in my view. Not necessarily what you acquire or what you artificially appear. I think that's what's killing our people.
All right.
You want to appear like you have no problem, accept the problem.
Yet, there's a very big problem. And that brings me to the aspect of another challenge that we are seeing, and especially for the retired population, is the rising cost of living. We're living in a time where every day you hear there's a revised price for a certain commodity, a certain entity has changed their prices, but yet the retired population are also facing the same cost of living. How is this a challenge, and how would you say, as KERO, you are looking to address this, and what maybe steps you're taking? Let me hear from you, Ahmed.
Thank you. I think to begin with, the cost of living adjustments that are taking place every day, the rising costs, the inflation, affects that meager pension that people are getting, which is not rising with the cost of living.
Sadly.
Yeah, traditionally and even in the world, when salaries of public servants are adjusted, salaries of retirees' pensions are supposed to be adjusted. In Kenya, it doesn't happen. It doesn't happen. And therefore, it keeps on eroding the little one is getting. And that is something that really, really has an effect on the retirees. You can imagine the cost of fuel just changed 10 years ago from 70 shillings to 140 today.
Yes.
And somebody who was earning 10,000 10 years ago is earning 10,000 today. And therefore, you have to use that 10,000 to meet the cost of your living. And that is why the issue of living in dignity, the issue of sustaining your life, the issue of taking care of yourself within this environment is very, very critical.
Yes.
And a few things happen in our environment, Jain. You see, today we're having elections in this country. People are talking of building roads. They're talking of improving schools. They are talk about everything, even giving people money. But nobody is talking about what they will do for the elderly. Nil. And they are voters, and there are very many. There are about 4 or 5 million Kenyans who are living, who are above the age of 65, 70. And therefore, you see, where do you put your emphasis in the social welfare of the country? Where do you put, where do you put it? And two, what is it? I mean, let me put it in another way. As a country, we must see that the cost of living adjustment must affect everybody, and therefore their incomes need to be adjusted.
Yes.
If we don't do that, you are leaving a lot of people by the wayside. It means the number of people who are falling into poverty, not only the ones who have retired, but the others, but every day is increasing. And therefore, maybe over 50% of our Kenyan population today are living below the poverty line. And that should not be the case.
And maybe in this case, because now I'm on the other side of beneficiaries, ask KERO, in this case then what are they doing to agitate for that? so that there is a bit
you
of...
see, we have had a lot of engagement with different government agencies. We've had engagement with Parliament. We had engagement with the Ministry of Public Service. We had engagement with Treasury. We had engagement with the Ministry of... the one that deals with social security, in all of them trying to see how best they can respond to matters elderly, the older people, the retirees. And we are getting some responses, one of them being the post-retirement medical scheme, the other being where SRC approved some improvement of the pension of the people who retired between 1995 to 2005, 1991 and 2005. And that has not been effected. But Treasury has been asked by Parliament to implement that before the end of this financial year. What do you call, so we are really trying and putting this medical cover as a stopgap, to help people live and attain medical cover. So that awareness, that follow-up with ministries and organizations is some of the things we are trying to put in place to ensure that people elderly live in dignity.
Absolutely, because that is the very big challenge that we see so many of the elderly. And for some of them, they even have relatives who are living, a decent life, but the elderly have been forgotten, have been left to languish in poverty. And that brings me to now the next aspects of, looking at the systems that you have in place as an organization to ensure that actually this pension of this particular retiree is protected from those that might try to take advantage of them, because we have seen people being conned out of their pensions by family members or people who know them. How is this an aspect that maybe you can or have been trying to make sure that the beneficiary is the one who gets the pension funds to sustain them through life? Let me hear from you, John.
The law is very clear on the pension is not assignable. There's that law or provision under the Pensions Act that you cannot, for instance, if you go to take a loan and you pledge your pension, when you default to pay that loan, you cannot come and attach that pension. It's not assignable. Mm-hmm. So to that extent, pension is protected. But that apart, I think what is most important is that with the low pension levels, you see, like in our social settings, with these pandemics, HIV, you know, this kind of thing, you find some of us grandparents taking care of some of the grandchildren. Mm. So to that extent, maybe the pension, although it's supposed to be enjoyed or sort of to sustain the welfare of that retiree, it is kind of to some extent eroded, mm-hmm. or sort of interfered with by the demands of the social structures that there are. So I think the Ministry of Social Protection has come up with this issue of Ndwiga. And you know, there was the issue that because you draw a pension, you should not get benefit from the Ndwiga. Mm. But what you are saying is that unless the pension levels are hiked so well, so that somebody does not feel the need to go and beg for that Ndwiga, then that retiree who gets a very low pension, maybe as low as 4,000 or even less, should be equally entitled to the Ndwiga. Because you see, as I said, in the social settings at home, yes, you find some of these grandchildren, they look to the grandfather,
a dependent,
and they, you know, and you can't. Our social, the way we have grown up, you cannot see them suffer.
Yes,
you'd rather suffer than they suffer. Mm-hmm.
And at KERO, are there plans that actually extend to the dependents in the case, in a case where maybe the member may be deceased? Are there benefits that spill over to the direct dependents?
Yes, those who are in the scheme, mm-hmm. once the beneficiary or the main principal contributor passes on, yes, they are entitled to a burial, an expense, a last expense, mm-hmm. of about 100,000, which is given to the family by NHIF. And therefore, that way then, you are giving them something to support them for in the short term. But coming back to the issue of protecting the pension, I want to say that in Kenya, the pension laws protect pensions. Pensions go to the person, and you can't commit it to any debt. Nobody can subtract or from the pension. The amount remains fixed, and you are the only one who can draw it. Mm-hmm. And therefore, it is protected from the vagaries of people coming to infringe on it. And I think that is one beautiful thing about the Pensions Act, that the money goes to the pensioner, to his account, and it's only when he's dead that, or she is passed on, that happens. But also to add to that is where the main beneficiary of the pension passes on, the spouse is entitled to continue drawing some benefit for some 5 years, yeah, so that it does not stop.
Cut off at that
immediately. Cut off immediately. Okay. And I think that helps mitigate the problems the family would face. And therefore, maybe what people face upon retirement and old age, when you get to your 80s and 90s, is that the other properties you had, land, housing, these are the things now where people can. And you know, it may not be easy to know when an old man in Ishaweri is being conned by his sons against, from his land and yes, his properties and what have you. And that is something I think the government should, through social protection and social support systems, ensure that those people feel protected even
post-retirement.
They have retired or even in their old age. You know, we are talking of retirement, yes. These are people who are in the public service. But alongside these people, there are their age mates who are farmers, cattle herders, who are also not active anymore and who require this kind of services. And that's why this issue of social protection should be such that it is given to people. And there are countries in Africa which pays social protection to the elderly. If you're in South Africa and you get to 70, unless you don't want it, you are entitled to social protection, a certain amount of money per month. In Namibia, it's a very interesting one, where you get that money, you keep getting the welfare money. When you pass on, the government will pay for your burial. And the idea is to stop the benefit somebody was getting, and the government pays for the burial. So what Kenya needs is the president formed, I think, something for the elderly in one of the ministries. But that should benefit from the people who are outside, who understand where the shoe pinches. Yeah? So we need policies, laws, and programs that take care of the elderly in the country. This is what is lacking in Kenya. And even if they are there on paper.
Jain, you asked the chairman about the benefits to the family, yeah? And he talked about the 100,000 that is given for the funeral.
Yes.
You see, I will tell you, where we deal with these retirees, people who retire sometimes, you may think that they don't have small families. So I know people who have retired and they have children who are still in primary school.
Yes.
So in this case, what you do then, when you're taking a premium, you are taking a cover for all that, for all of them, so that it also takes care of them in case you go. So the benefits remain. And you are taking a cover. For example, me, if I'm alone, I'm taking a cover for myself and myself alone. When I go, I'm gone. I'm not a burden to the others. But if I have a family, then I need to also take care of them. Maybe what KERO should tell us also is, what is it do I need to become a member, and how do I become a member, and what are those benefits like, what are the covers like, so that in case I decided I want to take care of these children. Because now the Secretary General talked about the people who are dependent.
Yes.
How do you help them? Because now if they are looking at you, you are the person who is going to take care of their medical cover when you are also retired, and then it becomes a big challenge.
It becomes a big challenge.
So I think we
can just pick it up at that point. Let me start from, let's hear from John.
I think basically the most important thing is to address the issue in its proper context. The government really is committed. I think it is in the public interest to have universal health care. So that, the idea here is that, like the chairman was saying, even with the insurance cover they have negotiated the NHIF, quite a lot of our retirees cannot afford it.
Yeah.
Yes.
And therefore the government should come up with a program whereby the rates are subsidized. Heavily subsidized, so that a lot more of our retirees can be able to join at the rates they can afford, and not burdening their own children to take care of them.
Okay.
So I think that when it comes to the dependents, like the children of your children, there should be that universal health care cover, not necessarily that they become a burden to you, but the state should own up to those kind of problems.
If anything, you would be complementing the benefits.
So that you want to complement by way of, but basically it's a state problem.
Okay.
Healthcare, good health is a state problem.
All right.
And therefore the question is, if somebody wants, if somebody was a senior officer in the government, where he was taken care of by, reasonably good insurance cover, when he retires, it should not be a situation where he's left out onto his own to start now lobbying for insurance cover here and there.
All right, now my directors tell me we are almost out of time, and I think it would be rightful for you to just address that aspect of looking at KERO. How can somebody join? Is there an age limit, or what are the requirements that one needs to be a member of KERO? Very briefly.
Thank you. Any retiree from the public service, whether he retired many years ago or he retired yesterday, can join KERO upon production of a document to show the person retired. Once you join, you just pay 1,000 to become a member, and you bring, if you are married, you come with your necessary documents, marriage certificate,
to verify
your ID card, photograph, and you join. Once you have joined, then from there you can join the scheme. You can join the scheme, and the scheme has several categories. There's one, KERO 1, KERO 2, KERO 3, KERO 4, KERO 5. Each one of them has a different premium, and the premiums can be available to all the people who join KERO. But the most important thing is to ask members of the public service, even the people in the parastatals like yourselves here, the banks that belong to the state, and parastatals, all of them can become members of KERO once they retire. And that helps. It helps, it improves on the universal health care. But coming back to the, what do you call, the extended family system, even under the normal insurance, it does not take care of the extended family system. It takes care of the immediate nuclear family. So I think there is need for all of us to see how best to register the extended family, the grandchildren, and those people who live with us, or our parents who are still very old, in the universal health care or any other scheme that takes it. But what makes it even more difficult, Jain, is that when you reach 70 or thereabout, most of the private insurance covers are shy to deal with you. They think you are on your deathbed. But I can tell you, the average age of the members in KERO is about 74 years of age, meaning most of our members are in their 90s and in their 80s. And therefore, the thing is, the insurance regulatory authority must look at the insurance environment in this country, that it should be friendly to everybody, regardless of the age.
All right.
This is the thing I would like to say. The insurance regulatory authority should look at insurance premium covers to take care of all people from 1 year old to 90-year-old. And the government must also take care of these people. And finally, our people aspiring for political office, there's guys who want to become the president. If they want our votes,
what plans do they have?
Then they have to do something and talk about the elderly. Thank you.
Fantastic. And again, this is a call to action message also to the Ministry of Public Service, Gender, Senior Citizen Affairs and Special Programs when it comes to addressing concerns that heavily touch on the elderly and the retired in our country. A lot needs to be done. Now, due to the interest of time, we have to pause at that particular point. We are completely out of time, but of course, this is not a one-off discussion. We'll be making time for more and more of these discussions to just make sure that they're getting the attention that they need. But we have been speaking with Elly Ndwiga, who is to my immediate right, who is the chairman of Sauti Sacco and a beneficiary at KERO. At the center, we have Ahmed Hussein, who is the chairman of KERO, that is the Kenya Association of Retired Officers. And to my extreme right, we have John Wachira, who is the Secretary General at KERO. Thank you very much, gentlemen, for
calling on all employees to join KERO so that we can agitate our interests.
There we go. And at that point, we want to call it a program. Thank you so much for being with us. Be sure to join us again tomorrow morning. But for now, it is goodbye. My name is Jain Wambui.
Thank you.
Thank you.